Hello, everyone, and thank you for joining us today. I have the privilege of introducing Dr. Mark Tafoya at Pacific Retina Care in Waipahu, Hawaii, who will share with us some of his clinical experience in using the Navilas navigated laser. Dr. Tafoya?
Thank you, Trey. I'm Dr. Mark Tafoya. I'm a vitreoretinal specialist with Pacific Retina Care in Honolulu, Hawaii. And today I'm going to discuss navigated retinal laser by Navilas. I'm going to discuss why I use a navigated retinal laser and how it has impacted both myself and my patients in my practice. I have no financial interest in anything discussed today. So the navigated retinal laser, my story is I'd been using an Argon 532 laser, and I first became acquainted with Navilas navigated laser in about 2016 when I went to the Retina World Congress in Florida. At that time, I saw this laser. I was very intrigued with the technology, and especially with the pattern laser and the very precise patterns that it was showing. So a year later, I went back, and at that point, I decided to purchase the lasers. So this is the laser that I have in my office. And transitioning from a 532 laser that I did have with eyepieces, this transition was like going from a flip phone to a smartphone. The technology in this instrument is very advanced, and it's one of my favorite instruments in my whole armamentarium in my office. This navigated laser, it maps the overlays. I can take the OCTs and fundus fluorescein angiographies and overlap it and have very precise treatment patterns. I really enjoy the heads-up technology that it has, and no longer have to look through eyepieces. And it's very precise for both the focal laser and for peripheral laser. So why do I use a navigated laser? Like I said, the precise patterns that this laser offers is head and shoulders above the laser that I had before. In my previous patients, I see a lot of diabetics. I was very frustrated with lesions like macular edema and diabetic macular edema that was present. And after several injections, I still had edema very close to the fovea. And with my old laser, it just was not possible to treat those. But with the navigated laser, it's very precise. You can protect the areas you do not want. And it offered an extra treatment armamentarium that I can give my patients. This navigated laser also gives you a heads-up technology. So no longer are you sort of hunched over looking through eyepieces. You can look at the heads-up screen. You can see your patterns, and it offers us, ergonomically can help me to in my career, that I don't have to stop practicing because of back and neck pain. So the navigated laser, it's an all digital retinal laser system, and it's very precise patterns. It's a 577 wavelength laser, and it has wide field capabilities as well as micropulsing techniques. This is a better way to do laser. This one shows that we can use a contact lens system for focal lasers. It does not have to touch the eye. It gives us a heads-up display where you'll see the patterns that we make in the treatment patterns in the bottom part of the display, and the top part is the actual live procedure. You can also use infrared illumination, which the patients are very much appreciative, because with the older laser, if you have when the light comes on, they cannot keep fixation, so it's a little more difficult to perform laser with the eye moving around. The infrared laser, patient's fixation is much more steady, and you offer a more precise and accurate treatment. It also has these smart controls, which you can, a lot of different features through that handpiece. So why another laser in all this age where we're doing all these injections? So, what I said again was doing lots of injections every day, but there's some lesions that just don't seem to go away no matter how many injections I've given. And so the patients are they're always asking me, why do I need another injection? You already gave me one last month. As my condition improved, but without those injections, the condition would just progress. So the navigated laser gives us more precise treatment in those areas that are stubborn and do not seem to go away. Because oftentimes the patients are looking at me, it's like, I got to get another injection. Some patients, no matter how many injections they get, they have a lot of anxiety. And in the times when I can offer them a laser instead of an injection, especially this laser, they are much more appreciative. And that also will lead to them coming back for their appointments instead of no-showing for appointments because they're afraid to get the injection. So when you looked at the DRCR net protocol T treatments, what we learned from there is that, there's these high injections and they still had some patients get laser. So what we're doing now is we have 21st century technology and drugs, but we're still living in 1980s laser technology. This is the first complete one, especially for all these diabetics. Where I live, diabetes is an epidemic in Hawaii. About 1 in 3 people have diabetes in Hawaii. And where I'm located, there's a high volume of diabetics, and they're all young working population. So this laser offers a better treatment for diabetic macular edema and a faster, more complete treatment for my patients with proliferative diabetic retinopathy. The DME patients get more precise, complete, and effective focal treatment compared to my previous argon 532 laser. I can give them micropulse therapy when needed. The PRP treatments before the other laser, I might have to do 1 to 3 sessions to complete it. Now I can do 1 whole session of complete PRP, and it's much more comfortable than my previous 532 laser. And I really enjoy the pre-planned treatments, and it's a lot faster than my other laser. So navigated treatments, the proven benefits are, it gives you a comprehensive treatment and reduces patient burden. They may not have to come back as often as they do. There's very precise treatment patterns that can reduce collateral damage. It's maximum patient comfort for both the patient and myself. It's a very safe laser, and it's a very enjoyable laser. Now lasers become much more enjoyable experience for myself and the patients. So this is what I've been seeing. So I had this patient come to me, and his exact saying to me was, my doctor told me my diabetic retinopathy was resolved, and he wanted to know why he could not see. And these are the type of laser treatments that I see, where there's dense, heavy laser. Sure, they do not have any diabetic retinopathy, but the whole back of the eye is scarred from heavy treatments, and this patient just had a small window left in the macula. These are some other examples that I see where I'm at in Honolulu. Sometimes I see patients from the Pacific Islands, especially like from Samoa, where traveling doctors will come through. And this is an example of the type of laser that I see that comes from some of those patients. And so this patient had laser, but you can see that they missed the mark. There's a lot of areas that did not get treated. The laser that they used, they did heavy treatment in the macular regions, and that just scars your macula and leads to poor outcomes. And this is the other eye that was done. This is the autofluorescence in that patient and autofluorescence in the other eye. So the clinical applications for this navigated laser, we have focal laser treatments that are very precise. We can use micropulse technology when needed. And there's also the peripheral PRP laser, and also treatment for retinal tears and lattice degeneration, as well as other peripheral pathology. So the navigated macular laser treatments, it looks like this. You can see that there's 2 attachments with this laser, and there's additional one coming. This one shows the non-contact laser on-contact attachment for macular laser. And the screens on this one, you can use overlays of OCT and fluorescein for very precise treatments. The doctor makes the plans and then we perform the treatment. So focal treatments, you have a contact lens-free system. It has eye tracking technology, which I really appreciate. It's very safe compared to my other laser. If the patient moved, you were worried about laser spots in the fovea. On this one, I do not have to worry about patients' movements. The laser will not fire in the areas where I block off that I do not want the laser. This has very precise pattern laser treatments. You can pre-plan all your treatments. You can overlay OCTs and fluoresceins and micropulse technology when needed. So this is examples of macular laser treatment in the upper left. You can see this is, you'll take a digital fundus imaging. You can see a diabetic with diabetic macular edema and exudates into the center foveal region and just juxtafoveal area. You can overlay your OCT and make your treatment plan patterns and mark off the foveal area so no laser gets applied to those regions. You can treat the patient under this infrared technology, so that keeps the eye steady compared to having the light on. And then the treatments are very precise. And at the end, you get this digital report that they show down on the bottom right. This is an example where we have the fluorescein angiography overlaid, and we marked off the area, and this we can apply the treatments. Microsecond pulsing technology, is based on very low intense laser delivery system and ultra short and repetitive pulses lasting a few millionths of a second. There are fewer side effects and scarring at the macular level. So all those lesions that I'm seeing very close to the foveal region, I'll micropulse those areas and it leaves no scarring and compared to any other laser that you would put in there. So it's a tissue-free friendly treatment. There's a series of short micropulses with in continuous wave laser. There's photostimulation instead of photocoagulation. It preserves your retinal function and it avoids retinal scarring. This is what we do. You overlay the OCT over the image. You apply your treatment plan and then you perform it, and it will document the areas that you have treated. So if you have to go back and treat it, you're very precise in your treatment. And this is another example of a micropulse treatment on a patient. So I'm going to show you some examples of patients that I've had in my practice that have been treated with a Navilas laser. This was a 65-year-old diabetic male. His right eye had visual acuity at 20/50. His hemoglobin A1C was 8. He had a history of 6 anti-VEGF injections, and he had no previous laser in this eye. This is what his OCT looked like after those 6 injections. You can still see he has diabetic macular edema present. He has chronic DME. And then after the treatment, you can see how it's reduced. So this is a before and after. The pre-Navilas laser treatment, the visual acuity was 20/50, and afterwards, 8 weeks later, 20/30, the macular edema is reduced. And this is the colored OCT that was present. And so you can see how the Navilas laser using this technology has helped me improve vision and help the patient reduce the treatment burden of injections. Here's another example. A patient had macular edema. This one was after this is a patient had macular edema, and the macular edema was in the papillomacular bundle here. So you can see significant macular edema present. I did micropulse technology on this one, and the micropulse treatment was applied, and this is what they looked like afterwards. So you can see how it was reduced 4 weeks later. And it was a very successful treatment. The patient went from having some distortion present, and the distortion resolved. And that was 4 weeks post-treatment. Moving on to peripheral treatments, the Navigated Laser System provides pre-planned multi-spot laser treatments, and you can do the fluorescein angiography overlays if you need. This one is much more comfortable than my previous laser. And the workflow, I've utilized technicians to help me with the images. And so this one here, I use a contact lens system to get the wide angle viewing of the retina, and I make the pre-planned treatments. So this is sort of a faster way to do laser compared to what I did before. There's a rapid delivery. You got equal distribution of spots. I can import the fluorescein angiography when needed. And it's the learning curve to do this is pretty quick. And I was able to catch on fairly quickly. And you can also treat retinal tears and lattice in the far periphery. So this is in my clinic and one of my technicians. And what I've learned for patient flow wise, I have a couple technicians that can put the contact lens on and take the images and do some treatment plans. And then I'll come in and review the plans and then proceed from there. So it saves me some time in doing this procedure. The technicians that I have, if you want to incorporate this, what I found is the 2 techs that I use, they play video games a lot, and they love the technology, and that they were very fast learners in this workflow. And so what I usually do is when I do my plans, I do the first plan around the arcades, and I mark off the macular region. And then what I'll do is I'll do the periphery plans in like pie segments. So initially I tried doing larger segments, but I find I can treat the patient quicker in smaller sections. So usually about 7 to 10 areas. And it's really based on what the anatomy looks like. I look at the larger vessels and do these multiple pie wedges throughout the periphery. And the treatments go pretty quickly. So you can see examples of the pie wedges. What I find is the larger the pie wedge, it's a little harder to do. If they're smaller, it's a lot quicker. So this is an example of the patient that I have. On the bottom, you'll see the treatment plan, and the top is actually the live procedure or an infrared, and then the treatment plan comes on. We have marked off the optic nerve in the foveal region. These were some of the first ones I did. I've modified the patterns a little bit. This one's a little bit on the more dense side. I've since adjusted that a little bit, but you can see how the plan is very quick. The patient has steady fixation. The treatment comes in at a very rapid pace. And you don't have to worry about hitting areas that you do not want, because the laser will only treat the areas that you've marked. And so this first pass, when I go through, we'll mark off that center area. And then that's 366 spots right there. So then we usually the patterns will sort of look like this, and it's very precise. I can do a complete PRP in probably like 10 minutes, 15 at the most. And this is the other eye. We'll move on. This is a 52-year-old female that flashes in the left eye for 1 month, and then presented today with new floaters in that eye for the past 2 days. You can see how she has a fairly new tear in the superior temporal quadrant of the eye. And what we did is we applied the Navilas laser to the peripheral break. So this is fairly quick. It's precise. The patient complains of really no no pain, discomfort compared to my other laser. It was very rapid. And so this is what the plan looked, the picture looked like, a few weeks later. The lesions were all healed, and it is a very clean laser. And there's autofluorescence. So this is another example, a 60-year-old male with sudden onset of new floaters in the right eye for 1 day. This patient had a vitreous hemorrhage. When I first made my transition to this laser, I was worried about treating peripheral lesions. But this one, it has actually been easier than when I did indirect laser to patients. So you can see the vitreous hemorrhage present in the retinal break superiorly. I applied the laser, and the vitreous hemorrhage is resolved, and the retinal break is sealed. I also did a larger tear here superiorly, and the treatment plan, you mark it out, and was able to do the treatment plan fairly quickly. So this is another patient that I saw. This was a 15-year-old male presented to clinic with both parents. The patient had new floaters in the left eye for the past week. The family history was the father lost vision in the right eye after a retinal detachment, and he reports he's only able to see large objects from the eye after the retinal detachment surgery. Additional history was his older brother is 20, recently had a retinal detachment surgery in the left eye. He's currently recovering. So the parents took this patient to an eye doctor because, and they most recently said that he had weak spots in his left eye. And so this was what presented to my clinic. A 15-year-old as a father with poor vision in one eye from a detached retina that did not recover well. The brother with a recent retinal detachment surgery, and you have this patient with new floaters and a large lattice lesion inferiorly, and the patient's parents, they want these weak spots treated. So what do we do? Do we treat this, or do we observe this? So they were very adamant that they wanted this treated, and this is what we did. This is the 15-year-old, and then with weak spots and new floaters. And at first, he seemed like he was going to be a little scared in the laser treatment, but he tolerated the procedure very well. And so you can see where I had already treated the larger lesion and the little smaller lesion that was present. We marked it off. I find that if you put the stop signs in there, it's not covering the fovea, but it helps for the camera to stabilize the eye in the picture. And so he's 15 years old. Was very worried about getting the treatment, but you can see how he's pretty steady. He's not moving around. The treatment's very fast, efficient, and very effective. So you see that when we make a couple rows of laser, the treatment pattern will come in very fast. And so that's our treatment on the patient. This is what the photograph looked like afterwards. So, comparison, with this laser with other lasers, why I do Navilas laser, it's a very efficient treatment for patients. You can use the navigated laser system, and you can use overlays of OCTs. It's comfortable for the patient. You can use infrared technology, so the eye is more stable. You can have documentation of your treatment, but overall, it's a much more safer, effective treatment than what I had with my previous laser. So that is why I use the Navigator Retina laser. I hope you take a look at it, but it's changed the way I practiced retina, and it's my most favorite instrument in my office. So mahalo for listening to my presentation, and contact Navilas if you have any questions. Thank you.
Thank you for sharing with us, Dr. Tafoya, and thank you for your time.
Thank you.